So next up, we have Grace Sventek from the University of Rochester as the presenting author, believing she will introduce her co-authors. The title of the presentation is Disparities in Pregnancy-Related Outcomes During the COVID-19 Pandemic. Thank you, Grace.
No, dang. Clicker should still work. He should still be able to see what's going on. Yeah. 15 and then you're good. Fantastic. Let's go.
All right, so I'm Grace, and I'll be presenting some work that my PI, Elaine Hill, and I've been working on for the past year as part of our pilot grant. I'll be talking about disparities in pregnancy-related outcomes among the Medicaid population from 2017 to 2022. So first, some background and motivation. The maternal health crisis in the US has been worsening over time, and studies have shown that most maternal deaths are preventable. In addition, many maternal deaths can be attributed to mental health causes. And in the bottom right of this slide, it's showing the maternal mortality rate by year. So each bar represents 2018, 2019, 2020, and 2021, and it's grouped by total non-Hispanic Black, non-Hispanic White, and Hispanic moms. And we can see that the maternal mortality rate has been increasing for all groups, but has increased at a disproportionate rate for non-Hispanic Black mothers who already had a higher baseline rate. Our pilot is focused on Medicaid-covered pregnancies, and we're hoping to determine how more Medicaid coverage in the postpartum period affects postpartum outcomes. So some background on Medicaid coverage for pregnancy is that before the pandemic, states were required to provide Medicaid coverage to low-income people for pregnancy, but many lost coverage within 3 months of delivery. And then starting in March 2020, the Families First Coronavirus Response Act led to continuous coverage for Medicaid-covered births until Medicaid unwinding, which started in the summer of 2023. And then in April 2022, the American Rescue Plan Act allowed states to opt in to providing continuous postpartum coverage for 12 months. And in the graph in the bottom right, the blue states are states that implemented this policy between 2021 and 2023, and the green ones implemented more recently in 2024, 2025. The purple state is pending a proposal, and then Arkansas is the only state that has yet to implement this policy. So the aims of our project were to, 1, develop a maternal cohort in the Medicaid TAF data, 2, to quantify how the COVID pandemic exacerbated severe maternal morbidity, maternal mortality, and postpartum mental health disparities, and 3, to evaluate the effectiveness of continuous postpartum Medicaid coverage in preventing late postpartum mortality. So today I'm mostly going to be talking about aims 1 and 2, and then I'll show some motivating data for aim 3, and then we'll be presenting our full results from aim 3 at a future SBE CCC monthly meeting. So the data for this project is 100% Medicaid enrollment and claims data from 2016 to 2022. And in order to define live births, we followed a paper by Samantha Audi and co-authors that came out in 2024 using 2018 Medicaid data. And we extended their approach for the years 2017 to 2022. And a brief overview of our procedure is that we started with a cohort of individuals with sex equal to female and age 8 to 64 in the TAF demographic and eligibility file. And then we searched for any claims with a delivery-related ICD-10 code or CPT code in the TAF inpatient or other services file. Then for each individual, we subset to claims that were at least 180 days apart. For the pregnancy loss cohort, we included miscarriages, stillbirths, and induced abortions, and we used the same approach as for the live births cohort, except for using different diagnosis and procedure codes and allowing events to be 42 days rather than 180 days apart. So in total, we were able to identify almost 10 million live births and 3 million pregnancy loss events between the years 2017 and 2022. And of these, the plurality of individuals were under 26 years old. And for the racial and ethnic disparities results that I'm going to show in a couple slides, I'll be focusing on non-Hispanic white, non-Hispanic Black, and Hispanic individuals, since those groups make up the majority of our study population. So in order to get some idea of the quality of the TAF data for identifying live births, we compared the number of live births we found in the Medicaid data to the number of Medicaid-covered births found in the NCHS natality data by state and year. And what we found was that this difference was less than 20% for most states for all of the years. However, we had 4 states where for 5 or 6 of the study years, the difference was more than 20%. And then we had other states where we encountered issues for specific years. And we're still working to see if there's like data corrections we can make or investigating how to recover closer counts for some of the states that were different. Now I'm going to be talking about racial and ethnic disparities in postpartum mortality. So from before to after the start of the COVID pandemic, the postpartum maternal mortality rate increased by 47.6% for non-Hispanic white moms, 97.1% for non-Hispanic Black moms, and 68.4% for Hispanic moms. And when we stratify by early postpartum and late postpartum, what we find is that most of this mortality increase is driven by mortality that happens more than 43 days after delivery. This slide is showing the percent of births where the mother had a mental health related emergency department or inpatient visit in the year following delivery. So we stratify by anxiety, depression, bipolar, and suicide related visits. And we find that anxiety and depression related visits are the most common, and they both have increasing trends over our entire study period. We do see an increase during the COVID pandemic, but it's unclear whether it's just a continuation of the previous trend or could be driven by pandemic-related factors. Next, we pooled all of our mental health-related types together and looked at the percent of births where the mom had any mental health-related visit and stratified by race and ethnicity. We found that non-Hispanic white moms had the highest rate of mental health related ED and inpatient visits, but that the rate was increasing for all 3 groups that we studied over our study period. Now I'm going to show some graphs about Medicaid enrollment relative to pregnancy events. So this is showing enrollment relative to a live birth delivery. So the y-axis is the percent of beneficiaries who were continuously enrolled. And then on the x-axis, month 0 is the delivery month, and the points to the left are each month before delivery, and to the right are the months after. So what we can see is that most women begin enrolling as they become pregnant or get further into pregnancy, and we see new enrollments right up to the delivery month. And then another thing to notice is the orange line is 2022 births, and the purple line is 2021 births. So for those years, pregnant people were more likely to be enrolled before delivery than in pre-pandemic years. And then in the postpartum period, we see that the rate of 12-month continuous enrollment went from around 60% in 2018 and 2019 up to around 90% in 2020 and 2021. This is the same graph, but for our pregnancy loss cohort. And in this one, we excluded induced abortions, of which there aren't very many in the Medicaid data anyways. And we find a similar pattern where in 2021 and 2022, beneficiaries were more likely to be enrolled before a pregnancy loss event. And after the pregnancy loss event, we see that the rate of 12-month continuous enrollment went from 71 to 76% in 2018 and 2019, up to about 95% in 2020 and 2021. The reason I show those graphs is to provide some insight for where we're going next with this project, and that is to try to determine the effect of this increase in postpartum continuous enrollment on postpartum mortality. In some summary of the results I showed today is that we found increases in postpartum mortality for all race and ethnicity groups during the pandemic, an increase in emergency department and inpatient visits for mental health related causes over 2017 to 2022, an increase in continuous Medicaid enrollment from before to after the start of the pandemic. And we also found some state variation in the quality of the Medicaid claims data for identifying live births. And for next steps, we're going to further test possible mechanisms for worsening postpartum mortality during the pandemic, including access to care, COVID infection, mental health, and substance-related conditions. And we're going to continue working on AIM-3. So thanks for listening, and I'd like to thank the UO1 grant and the pilot grant for supporting this work.